Hello and welcome to our information session about the new UCL Partners CVD Academy. We're going to take you through some of the details about the Academy, how you can apply and what we're looking for in participants, but also crucially what you will receive as part of the UCLP CVD Academy. Before we do so, we'll just spend a few minutes talking about who we are at UCL Partners and why cardiovascular disease. So if we can go on to the next slide. I'll go on to the next slide again. And again, so for those of you who are unfamiliar with us, we're UCL Partners. We're an academic health science partnership, and we work across North Central London, North East London, and Mid and South Essex. We're a partnership organisation, so we bring together the NHS and academic partners across the geography to support and accelerate research and innovation into practice for greater patient outcomes. That population across that geography is around 5 to 5.2 million people. So we're working across quite diverse populations across that geography. So as I said, we bring together researchers and academics and innovation to spread innovation. And on this slide, you can see the various designations that are part of our partnership. Why cardiovascular disease? Well, as I'm sure everybody is really aware now, it's the leading cause of death in England. So something like 27% of all deaths in the UK are due to cardiovascular disease. So making that real, we know one admission every 5 minutes happens due to a heart attack or a stroke or another event caused by CVD. It has a devastating impact both on individuals and their families, and we know that stroke is the leading cause of disability. But it has a financial impact as well. So to the NHS alone, it costs more than £19 billion. But it's a major driver of health inequalities and accounts for 25% of the life expectancy gap. And we know that people from Black, Asian and minority ethnic backgrounds, older people, men, people with a serious mental illness and a learning difficulty are more likely to be affected by cardiovascular disease. But CVD is highly preventable, both through changes to lifestyle, but also by controlling some of those high-risk conditions. And that's really why we've launched the CVD Academy, to support you, colleagues working across primary care, to be able to help manage and care for people with those risk conditions. So I'm going to hand over to Aisha now, just to talk through what the CVD Academy is.
Thank you, Laura. So my name is Aisha. I am a senior implementation manager and a pharmacist by background. I'm leading on the CVD Academy, and this is a program which is aimed at supporting clinicians, so GPs, pharmacists and nurses working in primary care, to deliver transformation by guiding them through the stages needed to implement innovations in practice. In the Academy, we will cover two main aspects. So that firstly is how to implement innovations, and the second part is clinical management of cardiovascular disease conditions. We will have a combination of both virtual and in-person sessions. So we will have 3 in-person sessions throughout the whole program. These will be half-day sessions. The first one will be right at the beginning, so the day 1, which will be 7th of November. The second one will be around April time, and then the last one will be shared learning session in September 2024. We will also have 13 virtual sessions for the rest of the content, and these sessions will last either 1 hour or 1.5 hours around lunchtime. So for our first cohort, we will have 30 participants. So we're hoping to have 10 from each of the ICSs that Laura mentioned previously. So North Central London, North East London and Mid and South Essex. The selection of participants will be through an application form, and the deadline for this application is the 29th of September. We'll also have an interview process as well. So it is a total of 11-month program starting in November of this year, and we will also have CPD accreditation. So we've already applied for the CPD accreditation for the clinical sessions from CPD UK, and that is pending. We will also be applying for CPD accreditation for the non-clinical sessions. This will be requested after the program, and the reason for that is that we will be tailoring this program for the needs of the people on our our first cohort. So we can't submit that content yet, as it will depend on the needs and requirements of the participants of our first cohort. So I'll just hand over to Laura to talk a bit about the funding.
So the CVD Academy has been made possible thanks to an unrestricted grant from Daiichi Sankyo. So Daiichi Sankyo is a pharmaceutical company. They have a mechanism by which they offer grants to initiatives such as the CVD Academy, but really important to stress, so the company itself has had no involvement in the design or the delivery of the programme. You won't meet Daiichi Sankyo colleagues unless you explicitly want to through the programme, and they won't be delivering the content or talking about any of the medications that they have produced.
Thank you. So just to go over the aims of the programme, so we've got three main aims. The first is to build a network of professionals who can peer learn, share best practice and collectively problem solve. Obviously, we want to equip our colleagues with the knowledge and skills to lead and implement innovations. And as this programme is around cardiovascular disease prevention, our main aim is to reduce deaths from heart attacks and strokes. And lastly, to develop a group of experts who can help shape and lead CVD-related innovations of the future. So this is obviously an educational program. It's around learning. So I thought I'd pull out a few quotes on the benefits of learning and gaining knowledge. The one that I really like was around "Tell me and I forget, teach me and I may remember, involve me and I learn" by Benjamin Franklin. And I think that this really does reflect a lot on the CVD Academy, as we really want to involve everyone who's part of the program to share learning, to gain knowledge, to build networks, and really to build on their ideas for innovations and transformation within primary care. The content of the CVD Academy. So as I said before, the content will be tailored to the specific needs of the cohort who are on the programme. We will identify these needs through the application form, through the interview process. There'll also be a skills mapping exercise as pre-work, and we will have a short conversation with all those participants who are going to be in cohort 1. The implementation sessions will be a combination of these topics named here. There will be a few that we will definitely have as part of the program. So things like data collection, patient public involvement will definitely be in there. Some of the others will be guided by the needs and wants of the participants of cohort 1. The clinical sessions will include management of atrial fibrillation, hypertension, raised cholesterol, and chronic kidney disease. So with regards to the project, the CVD Academy will support individuals to implement their own CVD-related project. So we're looking for projects to be focused on either atrial fibrillation, hypertension, raised cholesterol, or chronic kidney disease. And we're looking for a variety of projects across these CVD conditions, but definitely at least 8 projects aimed at atrial fibrillation. So who is the Academy for? It's a free program open to primary care clinicians. Just to note here that backfill is not provided, but it is open for GPs, pharmacists, and nurses working in primary care. These clinicians should be working in our patch, so one of our patches in North Central London, North East London, or Mid and South Essex. And we don't actually have a requirement for applicants to have been qualified for a certain number of years. So, even if you're new to your role or you've been working for many years, then that's absolutely fine. Please do put your applications in. The only thing we ask is that you must be supported by a line manager or your clinical lead to attend sessions and complete the project. So in terms of person specification, we definitely want everyone to be either a qualified GP, nurse, or pharmacist working in primary care. You must be passionate about cardiovascular disease prevention and open to sharing learning with your peers, exchanging ideas. We want those people on our program to be dedicated to leading transformation in primary care. If you have a CVD focused project in mind, that would be great. If you haven't, then that's okay as well. We can help you to develop that. Also, you should be able to work well in a team and also alone. And finally, be keen to be part of an ongoing network of leaders in transformation, focus on CVD prevention. So we don't want the end of this program to be the end of your, communication with everyone else on the program. We would like that to be continuing and you to be building on your networks from that. In terms of time commitment, then we have a requirement for all participants to attend at least 75% of sessions. And we already have all of our dates of the sessions on our website. So please see our website for all those dates. In terms of the pre-work, we will send that to everyone who is successful from the interview process, and it should take a maximum of 2 hours to complete that. And in terms of time commitment throughout the program, we say a minimum of 4 to 5 hours commitment per month, and that does include the program sessions as well. So the benefits, there's many benefits for the participants on the program, as well as the organizations that you come from. So for yourselves personally, you will gain knowledge and transferable skills on how to lead change, update your knowledge on the management of cardiovascular conditions that I've already mentioned. You can include this as part of your CPD, and then also building relationships with others, sharing perspectives, being curious about differences, and also building your network of peers. And also you will gain an understanding of our innovations at UCL Partners, so those like practical care frameworks and also CVD action. For the organizations, they will gain insight into new ways of working. Obviously, this is around cardiovascular disease, but the principles will be the same. So if you wanted to later on use this knowledge or skills for other conditions in other areas, then you could definitely do that. Reduce the risk of morbidity and mortality for patients with CVD, and be well placed to implement future innovations as well. So for support for everyone on the program, there is a dedicated email address. So you could email that and we can respond back to you. There'll be group coaching sessions every 3 months. There'll be a community of practice every 2 months. And also this program is led by UCL Partners Cardiovascular Health team. And we are experienced in implementation. If anyone has followed the work that we've done for the practical care frameworks and the awards that we received from those as well, you will know that we've been doing that for a while and it's been really successful. And then finally, how to apply. So please ensure that you've got the support of your line manager or your clinical lead before applying. Please note the dates of the program on our website, so you know whether you can attend at least 75% of those. Also see our FAQs on our website as well, and then you can complete the application form. Deadline is 29th of September, and the interviews will take place between the 11th and 13th of October. And that's it. If anyone's got any questions, please add that in the chat box or you can raise your hand. Thank you very much.
Just to add that we're really keen to ensure this really meets the needs of people taking part in the CVD Academy. So if you're listening to this and thinking it'd be really great if they could put on a session on something in particular, please do let us know. Or if there's a particular type of support you think would be useful, again, do let us know because we can factor that into the planning and the development of the CVD Academy.
Thank you.